Injecting the Glabella, important safety tips and advice on how to get consistent results and not cause side effects. This week we're going into all of the detailed questions that you guys have been asking. What about the difference between male and female glabellas? What about injection depth? How do we avoid the frontalis? How do you avoid a droopy eyelid? These are all the fundamentals that you must have clear in your mind to inject with confidence. So let's get started. Before we dive in, I've created something new that I think many of you are going to love. If you want to learn systematically, cover all the injections, processes, and all the information that you need to be a top-notch injector of botulinum toxins, make sure you click on the link that comes with this video to find out more. Injection confidence always starts with understanding the anatomy. So what's the anatomy of the glabella that you must know? First of all, it's all about the origin and the insertion of the core muscles that we're going to treat. The main muscle is the corrugator supercilii. This muscle runs medially from the nasion all the way up to the insertion point just lateral to the mid-pupillary line above the eyebrow. That whole muscle is pulling inwards and creating your 11's line or crease. We also have the procerus, which pulls the brow down, and this muscle has its origin on the nasion and runs up into the dermis of the forehead. Those two muscles do most of the activity, but there's also an interesting muscle, sometimes debated, called the depressor supercilii. And this muscle is often described as part of the orbicularis oculi muscle, but sometimes also seen as a separate muscle. The truth is, for injections, it doesn't actually matter because it overlaps so closely with exactly where you'd want to inject the corrugator supercilii. Now, did you notice how those muscles all changed plane in terms of how I described them, starting on the bone and going into the dermis? This is a crucial piece of information for injecting accurately. We should do the same with our injections. Where we think the muscle is intermediate, we inject at an intermediate depth. Where we think it's superficial, we inject superficially. This also improves your safety. Let's go on to that as our next topic, which is how to avoid complications. So what are the complications that you might get from treating the glabella? Well, the most important one would be the eyelid. If you affect the levator pulpary muscle within the eyelid, you are likely to get a droopy eyelid. This only happens when you inject deep enough for the botulinum toxin to make its way into the orbit. For botulinum toxin to make its way into the orbit, we have to have injected deeply. The orbit is shielded by multiple structures. It's shielded by the orbital membrane, there's preceptal fat pads, there are the muscles themselves, which actually provide somewhat of a shield. So the depth of injection is key. If you know your anatomy and you're injecting at the right depth, it should be very rare to get a droopy eyelid. The next common complication would be around treating the frontalis muscle by mistake. So the corrugator and the frontalis muscle are actually intertwined. If you look at the anatomy of the corrugator muscle, as it becomes more superficial, it actually passes through the frontalis muscle. And that means at the point of insertion, which you can actually usually see when someone frowns, above that muscle is frontalis and lateral to the muscle is frontalis. If you get botulinum toxin into the frontalis at these crucial points, you're likely to get an asymmetrical eyebrow, so maybe one side will lift and the other will not, or even worse, a droopy eyebrow where the eyebrow slumps down and causes an asymmetry at rest or a tired appearance, which can either be unilateral or bilateral depending on where the frontalis was affected. Now that same issue with the corrugator muscle where it inserts is the most sensitive area for a misplaced injection. But actually all the way along the path of the corrugator muscle, you can still affect the frontalis muscle, which is above it. And this strangely happens to extremely cautious injectors more than it happens to others. And there's a reason for this. Sometimes when new and very cautious people start injecting, they want to leave a little bit of extra safety margin compared with what they were taught. They're very afraid of being near the eye, so they move a little bit superiorly, only 5 millimeters or so. But this usually means you completely miss the corrugator muscle and directly inject the frontalis muscle, and this causes a medial brow drop, often with a lateral brow lift, which is your Spock brow. These are the core complications that you might see and should be able to avoid now with botulinum toxin when treating the glabella. So why would a patient request treatment in the glabella? The most common reason is that they look cross when they're not. So this could be a crease at rest, sometimes called the 11's, but also can be that they are a habitual frowner. So someone who frowns all the time, whether they're cross or not. And these people are often younger who just happen to have that expression. Now that expression creates a negative aura on the face. It makes them look less approachable. And this makes them want to seek treatment so that they look more happy and therefore able to collaborate more with others. This is not how they request the treatment, but that's the underlying driver. People want to connect with other people, and a constant frown can stop you from connecting. So what are the typical injection points you'd use when treating the glabella? There are a number of different ways of doing this, and I'll start with the licensed dose. The licensed dose is usually a spread of equally sized injections of 4 units. That's for most of the products that are similar to the Allergan type nomenclature. So 4 units times 5 injection points. There's 1 in the procerus and 2 into each corrugator. Now this is a very effective way of completely neutralizing the glabella, but you can often get a very similar result, for some people a better result, leaving a little bit of movement with fewer injections. So the next most common pattern I would use involves 3 points. With this style of injection, we inject the procerus and 1 injection either side, usually also 4 units, but sometimes a bit more. And this leaves a little bit of lateral movement, which can be a good thing because it looks more natural. And of course, it does mean you need less product to create a good result. Another variation that I use for patients who really want a still result with no movement is to separate the final 4 unit injection into a 3 and a 1 unit injection. So this means you're injecting the procerus with 4 units, the bulk of the corrugator with 4 units, then a 3 unit injection at an intermediate point, and then 1 unit right into the insertion point or just before the insertion point of the muscle. And this means that your patient does not come back for the follow-up. If you haven't noticed this already, many patients will come back with a little follow-up request when they have a small twitch at the side. And that's quite a lot of time and effort for something you could have done in the first treatment. And that's why I put my 1 unit just near that insertion point. What about differences between male and female patients? Now, there's a lot of crossover where they are actually exactly the same in the glabella, but on the extremes, you tend to have much smaller and weaker glabellas in females and stronger, more muscular glabellas in males. I think there's also a difference often in the direction of pull with the glabella, and you'll notice that many females are a little bit more neutral with the angle of the corrugator, whereas more males will pull heavy and down. It may just be to do with the strength of the muscle, but overall the biggest difference from a clinical perspective is the dose of the botulinum toxin you're likely to use. There are very few females who aren't adequately treated with a 20 unit dose, but you will meet a fair number of men who need 30, 40 units even to completely make their muscles still. And this is particularly true if they are very muscular men who work out in gyms. That activity, the growth hormone associated with those sorts of activities, means that you have bulkier muscles that need higher doses. The way around this in your practice, if you're not charging by the unit, is to simply have a rule, like in the UK we often treat by areas. Just include in your small print that the areas are for up to 20 units. And then if you go over that, it becomes a second area. And that protects you a little bit, because I know many of you are treating men who have much bigger muscles and charging them the same as women and actually making a loss in your practice. So how can we save a little bit of toxin and still get happy patients? This is your bonus from me this week. The most important thing is to be accurate with your injections. So if you get your botulinum toxin right near where those nerve receptors are, you're going to get a slightly better bang for your buck than if they're a bit further away. So think a lot about your anatomy. The middle of the muscle is usually a better place to treat than the periphery. So if you focus on the belly of the muscles that you're trying to treat, you'll get a better result. So that's where our bulk of the toxin goes when treating the glabella, is in this injection here. It's also helpful to allow your patients to see the benefit of some movement. I personally like my glabella to work a little bit, because otherwise I feel like I can't convey certain points I want to emphasize in quite the same way, but I don't like developing the crease. So for me, an intermediate amount of movement is perfect, and the 3-point injection makes me happier than a 5-point injection. And you could have a certain cohort of patients who feel exactly the same way, who prefer lower doses. So have the discussion. You don't have to freeze every muscle on everyone's face in order to have a very happy group of patients. In fact, probably you'll have happier patients if you do it that way.